Good morning, everybody, and welcome to the Community Day, a very important, perhaps the most important part of the event. We have learned from each other over the last 3 days and over the last few years, as Lara said, and today is the day in which we translate those into practical applications and we hear from you what we are doing okay and what we might improve on. So we are here for your feedback. My task in this section is in 5 minutes or so, give you an overview of those that are called the rarer types. For those of you that are my patients and that are here and that might have the rarer types, please don't feel offended by the name. It has been a topic of discussion, rarer why. Let's see, do we have slides for the ones that continued after Lara? But we can start with a bit of historical perspective. So EDS, which is the acronym that we now use, and we use it so much that we tend to forget, responds to the first physicians that described individuals with hypermobility. And so they are Ehlers-Danlos, and we have moved away in genetics from naming conditions after physicians that describe them, but this one stuck. It's the slide is, can I see? Perfect. And so the early discoveries in, from a biochemical perspective, can you go back? Sorry, I am lost because I can't. There, yep, no. Go back up. Sorry about that. One more. There you, oops. So let's start with a few words of clarification, because we're going to use these words throughout the talk. You're going to hear it in the head study, and I thought it would be useful. Phenotype is just a different word by which we describe a visible characteristic. We see it on ourselves, we see it on our face, on our hands, on our body, or we see it biochemically. So the genotype is what we see in the genetic information. It can be a spelling change, and if that spelling change is common in the population, it's a normal variation or a polymorphism that you will see in the head study we sometimes use to map out where an important region in genetics is, or it can be a very rare spelling change that's associated with a disorder. We use the word mutation for that, although more and more you're going to hear geneticists talk about likely pathogenic or pathogenic change as opposed to mutation. But in general, a mutation would be a change that's associated with a phenotypic difference. And then there are changes that are in the genotype that refer to quantity of genetic material. So there are some genetic conditions that are actually caused by changes in that quantity of genetic material. Oh, thank you. So the first descriptions about EDS were related to the biochemical defects. And we have Dr. Baton in 1968 that described some changes. In 1972, Crane et al. Described a enzymatic defect in the lysyl hydroxylation. And then in 1975, Pope described a deficiency in type 3 collagen. In terms of classification, which is what we use in genetics and in medicine to put conditions that have similar characteristics, similar phenotypes together, the first one came out in 1986 with the Berlin nosology. There you see numbers. Those numbers somewhat stuck and have led to confusion. In the classification group, we have moved away from numbers, but there are some that you will still recognize, like EDS type 4 being considered vascular, or EDS type 3 being hypermobile. We're not going to use those terms, but I wanted you to understand historically where they came from. And then the Villefranche nosology, here you see a picture of those founding members that talked about the classical type, the hypermobility type, the vascular type. And I highlight here how several of them were already known to be associated with a particular gene, whereas the hypermobility type from the very beginning was known to not have a clear identifiable genetic cause. That said, it was transmitted in families, and parents had a 50% chance of having an affected child, and therefore the inheritance mechanism was considered to be dominant, and hence it was put together with this grouping with a series of characteristics. So Villefranche, many, many years ago, now we know all of these genes. Unfortunately, genes have acronyms that are complicated, but they all correspond to what the function is. So we have some of the collagens, we have CHST14, we have ZNF469. All of these are instructions that are critical and that are associated with specific monogenic rarer forms of EDS. As I said, we have moved away from the numbering, and we're now calling them classical, classical-like, cardiac valvular, vascular, arthrochalasia, dermatoparaxis, kyphoscoliotic, brittle cornea syndrome, spondylodysplastic, musculocontractural, myopathic, and periodontal. The task of the group now is to determine whether those names are enough and give enough clarity, or whether we should give them a bit of a last name. So I'm Roberto, but there's many Robertos, maybe not in Toronto, but I'm Roberto Mendoza. That makes me more specific. The advances of molecular technologies allow us to give last names to those conditions. And so we can use the phenotypic descriptor and attach a last name, the molecular etiology with the phenotype. I have an example in the bottom. So if you have soft, fragile skin, poor wound healing, and flexible joints, that's your phenotype. You meet the criteria for classic EDS. But classic EDS can be caused by mutations in collagen type 5A1 or A2, which are two different genes, so you would give it a last name. We're moving towards a dyadic approach. So we are still in discussions, but it might be that what you're going to hear is call 5A2 associated classical EDS or classical EDS call 5A2 type. We have not landed on the order. We think that the community will have an important say in that, in telling us, do you prefer the last name to be the gene or the last name to be the characteristic? This is the classification group. It's chaired by Dr. Francisca Malfay, who sends her regards. She was here until yesterday, but needed to go back to Belgium. And then the members you see here, as well as input from the vascular EDS working group and the CDS EDS working group. So we're looking forward to clarifying the classification. As Lara mentioned, hypermobile type EDS has a number of criteria, and we're going to hear a lot more about how hypermobile EDS fits into the monogenic types and in relation to the monogenic types. But historically, it has been here because of a phenotypic overlap. Thank you very much.